Hi, we have already created a video in which we have spoken about the 6 steps of getting a DDS in the USA after completing your BDS in India. If you have not checked out the video, first go and check that video out. In this video, we are going to talk to Dr. Inderjeet Kaur about her journey of getting into the DDS in the USA and the tips and tricks she has used. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. Dr. Inderjeet Kaur completed her BDS from Punjab in the year 2013. Then she moved to Australia, where she did her Masters in Dental Public Health at Perth. In 2017, she moved to the USA, where she worked in urgent care during the COVID times for almost 3 years. She is currently pursuing her DDS from the New York University International Dentist Program for the class of 2024. She is also the mother of a 4-year-old. Hi, Dr. Inderjeet Kaur. Thank you for taking your time and joining us.
Thank you so much, and I'm very glad for this opportunity. Have a very good, it's morning on my time, I think. So good morning to everybody.
Okay. My first question to you is, okay, when you were during your BDS days, did you think you're going to go abroad, or is it after you finished your BDS you decided, no, I want to explore the world, I want to go abroad and see countries outside? How was it?
So during my BDS, I really never had a single idea about going abroad. I never thought of it. I wanted to stay in India. I wanted to practice there, but it just happened out of a sudden, and I went into three different continents before coming to US. So it's just matter of life happened to me, and that's how things went.
So first you got into MPH. Why did you take a non-clinical field after dentistry?
So the dental public health, it was not MPH specific, it was dental public health, the one which
Okay.
I took. And the reason I went to Australia was that most of the countries do not have dental public health as a specialty. Even for US, even till date, there's nothing like a specific dental public health field. So I wanted to do something in public health for sure, but I didn't want to stick to a mainstream thing. I wanted to stick to dentistry. So I chose this program, which was Masters in Dental Public and Primary Health. It was based in University of Western Australia, which is on the western side of Australia, Perth, where I was living. So I went there to complete my Masters of Dental Public Health.
Okay. Then how did you decide again to shift back into clinical dentistry? Why was that shift back?
So I did decide going back to clinical dentistry while I was there because I saw the restrictions which I had being in a different country that I could not practice. I was very active into research while doing my masters. I was active in like I was doing research about DMFT score, that we were doing different kind of outreaches to see kids and everything. But I was not allowed to get into their mouth. Like I saw a cavity there, but I was not allowed to fill it.
So
So
you were
that
missing
was
dentistry.
Yes, it was something like, okay, I'm just standing right there. I know what to do exactly. I know how to help this kid, but I can't. So that was something which triggered that, okay, I need to get back my clinical license if I want to be a good public health dentist, so that it's not that we have to take another dentist who can do the fillings on those outreach programs and I can do it myself. So that was the trigger for clinical dentistry. But coming to US was an entirely different story. I never thought of coming to US also.
Okay. Uh, but you got into DDS, okay, when you were doing your BDS, you were not thinking of doing it. Do you think
Yes.
you would have done something different during your BDS days if you already had in mind that DDS was the way to go?
Yes, of course. A lot of things differently. It took me a longer route because I did not plan the things which happened to me. But if you are there and if you know you want to get into DDS, I would say the right time to start is in your third year or second year
Oh,
also.
so early.
Yes, because for DDS, being an Indian, just so everybody knows, it's much, much more complicated and competitive. We cannot compare our profiles with anybody else in the world because Indians rule like kind of majority of the applicants and even the number of students, but the schools want diversity, right? So they cannot have all Indians in there. So being an Indian, you have to put an extra effort, which starts right in your third year when you are doing your clinical, get into your outreach programs. Like I did those outreaches, but I was just doing for the sake of the school or for the sake of my criteria at that point, right? I did not really have that kind of goal or mission in my life, which came much later to me. So if you are there, start doing things which you probably won't just volunteer. Like volunteering is a big thing in US. If you're
Okay.
volunteering, you have to make records of it. I did a lot of volunteer work, but I don't have any records for that.
Oh,
So it's better that you have a record. It doesn't mean that you need to have a proper written statement for every single thing. Just a brief thing. Okay, you did there. You went there today. You did this thing, right? You helped these people. You went to a gurdwara. You went to a temple. You went to a charitable hospital, right? Click some pictures. Get those printed, right? Have those things ready with you. Get into a research program. Talk to your mentors in your school because they are into the MDS people who are doing their masters, they are into some kind of research there. So having your name attached to a research, it is a very big thing.
so
If you can
basically,
start that.
outreach programs and research is what they need to focus on during their third and fourth year so that they
Yes,
can build their resume.
along with your GPA. GPA is the marks.
Understood.
The
Understood.
marks.
So they have to even study well as
Oh yes, of course. You have to study well. Being Indian, you cannot not study, right?
well.
The
Understood.
GPA most of the Indians have here is about around like 3.6 to 3.9. It is out of 4, which means
Understood.
they're like above 70%, 60%, or like 75, 85 percentile of marks.
Okay. There's another part in the entire application process known as SOP, a statement of purpose. Okay. So in that, what all do you write? Do you write about all these things you mentioned, volunteer work and everything, or how do you go about writing it?
So statement of purpose is one of the, I like to say, the crucial aspects of your application. If that is
Okay.
screwed, you're screwed, regardless of what you have or you not have.
Understood.
And it is not your CV, first of all. I have one link. I think Dr. Satish can add it there for
100%.
how to write a statement of purpose. I have a link on my page. But just to brief out here, the statement of purpose, you have to write your experiences, but not as in, okay, I worked there for 5 months and I did this. No. Experiences as in terms of patient care, in terms of personality, how it made you grow as a dentist, what really impacted what you got from that program, that specific research, what kind of insight you got. So the the humanity touch, it should be there. A
So it's
personality,
basically your journey. You have to explain it in your flow.
but as in your personality, how you starting from day one when you decided to be a dentist up till you got graduated or afterwards, how you changed as a person, as a dentist, as a provider, and what your goals and how they impacted yourself.
Okay. So it has to be a more personalized approach. It just can't be
Yes.
one size fits all types.
So yeah, so it basically it's very step by step stuff. The first paragraph, most of the people write about why you wanted to become a dentist, first of all. Then how was your journey in your dental school? What kind of things changed you? How you decided if you did a master's, how you decided to get into that clinical thing, what you learned from there, and as a provider, what are your long-term goals and your short-term goals? What do you think about public health or giving back? They don't talk it public health here because it's more like giving back to the society where you come from.
Understood. So you told SOPs is the most crucial part. So on the other hand, do LORs, that is letter of recommendations, do they make a difference? And if yes, how do we go about getting those? Before you listen to the answer to that question, please do not forget to hit the like button below because the guest out here has taken time from a busy schedule to come and help you out. And I'm sure you subscribe to this channel because if you want to grow your career after BDS, this is the channel you need to subscribe to.
So LOR is kind of the thing. Okay, let's say I have a certificate, but then I have that mark sheet which labels that certificate. Okay, that is true. So LOR has an equal importance, but it's more like a stamping or a verification of what you have done and where you have done. So for LORs, I would say the dean's LOR or the principal in India back home where I studied, we don't have a dean, we have a principal. So the principal one is mostly compulsory for most of the
Okay.
schools. Then you need one of your professors who taught you, and then you need one of your colleagues. If you're coming to US, it's preferred to have a US dentist or a Canadian dentist. But if you don't have a chance to be in US or do volunteering or shadowing in US or Canada, then it's equally okay to have it from your Indian dental clinic practice, or your supervisor are there, or the senior dentist, or your colleagues over there.
Understood. So you need basically three of them at each level, one at the dean level, one at the professor level, and one a dentist who can state that you do a good job.
Yes.
Okay. So now you have told about the initial part. That's the SOPs, LOR submitting. You need to
Mhm.
study well. The GPS scores are important. And after that, they'll clear the INBD. But
Yeah.
a lot of people go through this entire process and they get stuck just at the end. That is at the interview portion. So what would you suggest that they do well or do different so that they can crack the interview?
One more thing for INBD, which we skipped. So most of the people think, okay, I'll just take a chill pill and I'll do it easily. There's no chill pill there. Just try to get it done in the first go. If you have a second attempt on that, I don't say that you can't get in, but it gets much more harder to prove
Oh,
yourself. So it's much better to get your INBD passed in your first go. Okay, and
okay.
now
That's
coming
an
back to,
important point.
yes, it's a very crucial part. Like when I was giving my boards, I didn't have that in mind, but luckily I passed both part one, part two in my first go. Uh,
Okay.
People who have attempts, it gets more harder for them.
Understood.
Like,
So they'll have a bias against you, thinking that you take more time to clear your exams.
not more time, that you are not, I would say you're
Competent
not
enough.
competent enough that you couldn't pass that, right? So,
Understood.
or being competitive, they are like, let's say there are 10 people, nine of them or eight of them passed in the first go, and two of them didn't. So you have to have something much higher than other eight of them
So
to
that you
tell them,
can better them.
I am better, I'm still better, right?
Understood.
So it gets more tough in that manner. And coming back to interviews, yes, so that is the last thing, but that is again one of the very important parts, because first of all, your application has to be good to be there, or they have to select your application. Then you have to show your personality during the interview, even if it's Zoom or in person, doesn't matter. Now most of the schools, as COVID restrictions are opening, they're going to back to in-person thing. So you have to basically connect to your interviewer. You have to have your confidence. You have to talk about your journey, in a confident manner, but not in a boasting way,
Understood. You
right?
should sound confident but not arrogant.
Not arrogant. So you don't boast about, okay, I did this, because the person sitting in front of you has done much better. Like right now, Dr.
Understood.
Satish has much more experience than me. But still, being confident of what you did or what your achievements were is really important. And going back to SOP, all of your interviews, even if they're open book or open book interview, is the one where the interviewer has your SOP or CV right in front of them. The closed book is the one where they do not know much about you, so you have to introduce yourself. So,
Okay.
regardless of what kind of interview it is, you have to pick up points from your SOP experiences, from your CV, and you have to connect those to that specific school, why that school is important, how you think you are a good match for them. Even if it is not asked directly, like sometimes they do ask, okay, why do you think you are a good candidate for us? But sometimes they don't. But every answer should reflect the point that, okay, I am a good fit because I have this in my thing. And with
Understood.
qualities, you do not say I am confident, you do not say I am punctual, you tell them a story. Okay, this was this let me highlight an experience about myself now. If I went to the outreach program, I'll just say I did like around more than 100 outreach programs during my 4 years in Australia. So that shows that I have a passion for volunteering and for outreaches. I don't
Understood.
have to tell that I'm passionate about public.
Okay. So you have to show your experiences rather than state that you are so and so.
And if you're punctual, you don't say I'm punctual. You say I was one of the people in my clinic or in my classrooms who was there early and who stayed back until everything was done.
Understood. Now you have explained the entire process in brief. My thing is these processes sound very complex. Do you think people can do this themselves, or they should do a part of it themselves? Maybe give the INBDA exams themselves, practice some with someone for the interview. How do you would advise people to go through the entire journey, with support or without support?
So for myself, I did it by myself, everything. And everybody who talks to me, I tell them, yes, you can do it yourself. It can be complicated, but it's better to go to the students who have been through the journey rather than going to some coaching people, because it is more personalized. You'll get much more tips. In case some people cannot write their SOPs, or if your English, you have an English barrier, you cannot write that good of statement, you may get help in that kind of manner. You get it reviewed. Like for me, I didn't even got it written, I got it reviewed though. So ask the like I did do for people, and many other classmates of mine, they just send us their SOPs. The students who are in the process, they send it to us, we review it without any charge, and we tell them, okay, you can improve it on this way. So ask students who are in dental schools, their Facebook groups, their Instagram pages, and everybody, trust me, they are more than helpful to let you know. But you have to introspect for yourself. If you think you can't, it's better to rather not to waste the time and get some help. Or if you think you can, like you can do something with just mentorship is something like, okay, you talk to me, you talk to somebody else, they guide you, this is the capit application, this is how you fill it, okay, this is what you do for your SOP. So that way you can do it yourself. It's not like not doable. But certain parts which I do suggest getting help is like in case for SOPs. And if you're not confident of talking to people, have some interview coaching done, or at least start talking to people in English, have your communication skills up there. And many people have hard time in TOEFL. So think of TOEFL exam as your communication skills. That will really help you in the long run when you are giving your interviews and when you are building a rapport or a trust with your interviewer.
Understood. So focusing on communication skills and knowing whether you're able to do it on your own or you need help is something you should decide. It should be an individualized approach.
Yes.
And there are different levels. Maybe you can do half of it yourself. You can go for a mentorship, or if you're not confident enough, you can go completely with someone else. But finding someone who has recently done it and has experience is better,
It's
because they
much.
would be able to, yes, it'll be a personalized approach.
So there are many Facebook groups. There are students who are from different schools who have experiences with different schools. Talking to them will give you a lot more insight into what you can do yourself or what you can do yourself. So the
Understood.
important thing is like seeing into yourself how you go.
Got it. What would be the takeaway from your journey? How the entire process you went, and yours was a completely route which you took. You went through Australia, then you went to US. You've gone seen a lot of things. What would be your suggestion to the young dentists who are just graduating today?
So one big suggestion is whatever you're doing, do it with your heart. Don't do it for the sake of grades or for the sake of getting into something or getting somewhere. When you do it with your heart, when you put your genuine effort in doing that thing, it reflects. It reflects in your journey, it reflects in your confidence. And don't think, okay, why I'm doing this? It won't really help me. But it will help you somewhere in the long run. Being in three different continents, talking to multicultural people, like having that diverse kind of experience really helped me a lot. I was having one of the most diverse kind of application, or you can say unique in a way that nobody has gone through uh, Australia and then going back to US. My first question was, why did you go to Australia? Because I was like, I never chose to go to, like it just happened. I never thought that I wanted to go to US. But if you have an opportunity that you know that you want to do this, it's much better to start early, talk to people, start getting to know about the system, how it works, and build your profile or journey in accordance to that.
Understood. And if people want to connect with you, how do they do that?
So one of the best way is my Instagram page. It's called The Dental Dream. I'm quite active there, and I'm also on Facebook groups, which is for the CAPIT. You can. My name is Inderjeet Kaur. You can message me there, DM
I
me,
will be
or
posting her Instagram link on our Instagram page as well as on this YouTube interview. So you can check it out in the description as well.
sure, perfect. And there are many good resources on my page about letter of recommendation, how to write those, how to write your SOPs. So you can check those out there.
So do not forget to go through her entire Instagram page. And if you have doubts, she's extremely approachable. Hers is one of the best active Instagram pages I've seen of people who have recently got into DDS out there in US, and they are supporting others in the journey.
That's
So,
very kind of you.
no, but it is really active. Dr. Inderjeet Kaur, it was lovely having you. Thank you for taking your time and joining us today.
You're more than welcome. Thank you. It was equally pleasurable for me.
Thank you.